Good afternoon, and thank you for joining us. This briefing is being aired live on YouTube. A reminder to maintain audio quality. Please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers and DHS Secretary-designee Andrea Palm. And available to answer questions are Dr. Ryan Westergaard, a Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, the Chief Legal Counsel for the Governor's Office. We begin the briefing with remarks from Governor Tony Evers.
Good afternoon, everybody, and thanks for joining us today. Well, we're not out of the woods yet, but we continue to make progress in the fight against COVID-19. Wisconsinites have done a great job of staying home as much as they can, wearing masks and maintaining social distancing while out in public and practicing good hygiene. At the same time, my administration is focused on our economic recovery as well. Earlier this week, the Department of Children and Families awarded just over $32 million to 2,367 early care and education providers through the first period of the Child Care Counts COVID-19 Emergency Payment Plan. The Child Care Counts program addresses a nearly universal desire to help early care educators by supporting the costs of providing care for essential workforce families, offering incentive pay for child care providers and individual educators, and assisting providers who are forced to close with the cost that is associated with retaining staff and reopening child care programs. Thousands of early care and education providers and educators stepped up in this time of crisis. Unfortunately, many of those folks are now struggling in the wake of the pandemic. Our Child Care Counts payment program is a key part of making sure families have access to safe, high-quality, and affordable child care. The second application period is open through June 19, so I encourage folks to visit the DCF website at dcf.wisconsin.gov to learn more and apply today. Today, I'm also happy to announce that in consultation with the Wisconsin Hospital Association, the state will be awarding $40 million in financial assistance to Wisconsin hospitals from the Federal CARES Act funding. These funds will help hospitals make up for lost revenue and extra expenses due to the COVID-19 pandemic. Losses and expenses from March, April, and May will be eligible for reimbursement if they have not already been reimbursed by other federal programs or insurance. Each hospital will receive funds calculated using the relative percentage of Medicaid claims paid to that hospital in comparison to all Wisconsin Medicaid claims. And we expect to make these payments by the second week in July. The work of Wisconsin hospitals is life-saving work, whether during a pandemic or not. But due to the COVID-19 pandemic, we know hospitals are stretched thin. This funding will help alleviate the financial strain felt by these hospitals and make it possible for them to continue their essential work. This pandemic has also reminded us health care should not be a privilege afforded by only the healthy and the wealthy. In order for our communities to stay healthy, everyone must have access to the care they need. Covering more folks and saving Wisconsin tax dollars remains one of my top priorities. We know that 70% of Wisconsin voters support expanding Medicaid. The people of the state want us to bring federal money back into our communities under the Medicaid expansion program and reinvest those dollars into our health care system. By expanding Medicaid in Wisconsin, we can improve access to quality, affordable health care for people across our state, and importantly, help address disparate health outcomes for people of color. We cannot ignore these disparities. We must continue to have necessary and important conversations about the harm caused by systemic racism, and we must take action. So I want to personally thank the peaceful protesters who continue to make their voices heard around the state of Wisconsin and the nation for keeping this conversation going and demanding change. These demonstrations are important, but if you've been out in large groups, it's possible you've been exposed to COVID-19. You can help everyone stay healthy and safe by getting tested, monitoring yourself for symptoms, continuing practicing social distancing, and always wearing a mask in public. You should monitor yourself for COVID-19 symptoms such as cough, fever, shortness of breath, chills, headache, sore throat, runny nose, and muscle pain. If you are experiencing any of these symptoms, get tested immediately. Otherwise, even if you feel healthy, it's a good idea to get tested 5 to 7 days after the event of possible exposure. You can get tested for free at a local testing site in your community. If the first test is negative, you should get tested again in 12 to 14 days. And now I'll hand it over to Secretary-designee Andrea for her COVID-19 update.
Good afternoon, everyone, and thank you for joining us again today. Earlier this week, we announced changes to the eligibility requirements for the Emergency Food Assistance Program, making it possible for more Wisconsinites to access nutritious food. This program provides locally grown food, including meat, fresh vegetables, and fruit, juice, and more to individuals and families through TFAP food pantries. Every county in Wisconsin has at least one TFAP food pantry, and enrollment at a pantry is confidential. We encourage you to visit the TFAP page on the DHS website to find out more information about eligibility and to find a pantry in your area. Today we are also announcing a $675,000 grant from FEMA to fund crisis counseling services for people experiencing heightened anxiety and stress during the COVID-19 pandemic. DHS is partnering with the Wisconsin Community Action Program Association to bring these services to some of our hardest hit counties. And we are also applying for a grant to expand these services to more counties across the state. These counseling services will be available in the coming weeks, and we will share more information as soon as the program is up and running. We know this is a stressful time, so this is a good reminder for each of us that our mental and emotional health and well-being need attention just like our physical health. I know I often remind you of the symptoms of COVID-19 in these briefings, and they are important to know because you need to get a test if you are experiencing them. But I also want you to know that if you are experiencing stress or are having trouble concentrating, feeling anxious or overwhelmed, that there is help available. Resilient.wisconsin.gov can help with coping strategies and provide resources like information and helplines and links to virtual meetings. It's okay to ask for help. In fact, I encourage it. I want to give you an update now on where our numbers stand. We have 66 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 16,153 tests. We have 366,054 negative tests, which is an increase of 8,942 over yesterday. There are now 21,296 confirmed cases of COVID-19 in Wisconsin, which is an increase of 333. Our total deaths have now reached 682. COVID-19 is still present and spreading in Wisconsin, and we need to remember to continue best public health practices. Wash your hands for 20 seconds, practice physical distancing. When you take your essential trips, wear a cloth face covering if possible. When you get outside to enjoy the lovely weather, please stay 6 feet apart. And if you're experiencing any symptoms or if you've been exposed to COVID-19, please get a test. And remember, it's okay to ask for help. Thank you for all you are doing to help keep Wisconsin healthy, and now we're happy to take your questions.
And thank you. We will now open it up for those questions. A reminder to maintain audio quality, to keep the phones on mute until it's time to ask your question. And in the interest of time, only one question per reporter per media outlet. And we'll begin today with J.R. Ross from WisPolitics. J.R.?
Governor, we were told late yesterday by Melissa that you were unaware of your conversation with Speaker Voss and Julia Fitzgerald being taped, but we've not been told who authorized that. Can you tell us what aide approved taping that phone call, and will there be any disciplined for authorizing taping a phone call with those guys without their knowledge or your knowledge?
I didn't hear the last part. I didn't hear the last part of your question or comment.
Will anybody be disciplined? So, one, who authorized the conversation be taped? And two, will anybody be disciplined for authorizing the taping that conversation without your knowledge or the knowledge of Speaker Voss or Julia Fitzgerald?
So there's two questions there, and I know we're supposed to only ask one, but I'll answer it in this fashion. I did not know about it. A staffer wanted help in taking notes, and that's why that staffer did that. And I will not discuss personnel issues in public, but needless to say, the practice has ended with this one time.
Thank you, JR. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thanks for taking my call. For the hospital funding, I was wondering how did you determine the amount of $40 million to hospitals as well as the methodology of how it will be distributed? Thank you.
So Sean, we obviously got a tranche of money from the feds and have been working through the needs across the state in the various parts of the economy and the healthcare sector. And obviously, it's not enough to fill the gaps for any of the folks who we have announced grant programs for, but we wanted to make sure that the amount would provide some meaningful relief, that it was a number that was high enough to provide some meaningful relief while giving us the ability to do that same meaningful kind of relief for other parts of the economy and the healthcare sector as well. And as Governor Evers said in his opening remarks, it's based on the relative Medicaid claims for the hospital relative to total Medicaid claims, and was a formula that we agreed to with the Hospital Association.
Thank you, Sean. Now to Rachel from TMJ4 in Milwaukee. Rachel?
Hello. When the High Court overturned Safer at Home, there were pretty dire predictions about a spike in cases. To what do you attribute the increasingly positive numbers in Wisconsin since the state reopened? And then do you still anticipate a new spike, such as this materializing in other states?
So I think broadly, I would say that I think Wisconsinites continue to do and take care of themselves and their neighbors and their communities by limiting their exposure to other people, by staying safer at home when they can. And that has been right. That was really important work to flatten the curve. And I think you're seeing folks continue to be cautious about their interactions with other people, broadly speaking. But I don't know, Ryan, if you want to say anything more specific.
Sure. Yeah, this is Ryan Westergaard with the Division of Public Health. I would say we remain vulnerable to at least small spikes, and we're continuing to see that in certain workplaces and certain communities. We're seeing those small clusters of outbreaks, and that's a risk that's probably not going to go away until we really have flattened the curve to almost nothing. I think there's reason to be encouraged that the response we've put together, the capacity that's been built up with testing and local public health, I think gives us good reason to be optimistic that we'll be able to respond in a quick way and prevent small spikes from becoming large spikes. So I would add that I think we're in a good place. We're glad that we didn't see large cases, and the better we can have timely information about what's happening locally, we can respond and prevent it from becoming a larger epidemic.
Thank you, Rachel. Now to Marty Glazer from Spectrum News 1. Marty? And a reminder, *6 to unmute your phones. Marty Glazer from Spectrum News 1. Okay, we'll move on then to Hope Kerwin from Wisconsin Public Radio. Hope?
Does DHS report repeat cases or instances where the same person is being tested more than once? And, could this potentially skew the data?
Right. I can take that one. So our data report individuals tested. So if an individual was tested more than once because they were being followed to see if they cleared the infection, or if they were tested times 2 weeks apart, they would be considered a single case and not multiple cases in our data. We are paying close attention to whether it is possible and whether it does happen people can be reinfected after a prolonged period of recovery. So far, we don't know that for sure that happens. That's an area of active research, but I think it's safe to say that the large majority, if not all, of our cases are individuals who are tested, and multiple cases get folded into one individual, or multiple tests get folded into one individual.
Thank you, Hope. Now to Scott Bauer.
I'm so sorry. This is Marty.
Okay, Marty Glazer from Spectrum News 1. Go ahead. Okay, now we'll try Scott Bauer from the Associated Press. Scott?
Hi, thanks for doing the call. Secretary Palm, can you tell us why Gene Ayers was asked to resign?
Scott, the Department of Health Services, consistent with other employers, does not comment on personnel matters. Do you have another question?
Yeah, could you tell us why Nicole Safer left?
Again, we don't comment on personnel matters. We'll move on to Jason Kelvey from WITI in Milwaukee. Jason?
Good afternoon. Wisconsin is a one-party consent state, so someone on the phone call with the GOP leaders had to consent, or we're dealing with wiretapping. So who on the call consented to the recording, and will you agree with the bipartisan calls to fire that person?
I can answer that for the governor. Staff on both legislative offices and the governor's offices were on the call, and staff did consent to it being recorded, so it's in compliance with the one-party consent rule.
Thank you, Jason. Now to Katie Anderson from WBAY-TV in Green Bay. Katie? WBAY-TV in Green Bay. Moving on then to Denise Lockwood.
Hello?
Oh. Is this Katie? WBAY? Okay, we have to move on to Denise Lockwood at Racine County Eye. Denise?
My question was already answered.
Thank you. To Will Cushman now from WisContext. Will.
Hi there. My question is for Dr. Westergaard. I'm wondering if you or other folks with the state are looking at or analyzing data related to excess deaths over the last several months in the state, and if so, if you could provide any type of interpretation of that analysis and whether or not you believe the official death statistics related to COVID are covering the majority of the deaths that we're seeing in the state due to the pandemic or not. Thank you.
Yeah, thank you. So the Office of Health Informatics has received mortality data from national sources. We analyze that in sort of an ongoing basis. And so it's being looked at, but not in a way that has a sort of a completed analysis that would allow us to draw conclusions. If there's other specific questions or things, I'd be happy to look into that, but it's not something that we have handy or that we've made public. But mortality trends overall are things that we track and report on a periodic basis. I'm sorry, I don't have more details about that.
Thank you, Will. Now to Ben Krumholtz from WLUK-TV in Green Bay. Ben?
Hi, thank you for taking our question. Governor Evers, how were you not aware that someone in your office was recording that conversation with Republican leadership?
How did I not know? Because I didn't know. We were on the phone. I was in a different place than other people were, so I didn't know.
Thank you, Ben. Now to Emily Shetler from the Cap Times in Madison. Emily.
Thank you. Thank you so much. Secretary Palm, two top health officials at the department resigning in the middle of the coronavirus crisis this spring. Can you speak to the public about how they should continue to have confidence in the department's handling of this pandemic?
So I think As it relates to our response to the pandemic, we, in partnership with the people of this state, flattened the curve. We did what we set out to do as it relates to protecting the health and well-being of our frontline healthcare workers, to not overwhelm our healthcare system, to reduce as much as possible those who became infected and who ultimately have died from COVID-19. And so I think, generally speaking, the people of the state should feel really good about the work we have done together in this pandemic. I think more broadly, right through the statewide response, whether it was DHS as the lead public health agency, our partners at National Guard, our partners at Wisconsin Emergency Management, our partners in DOA and other parts of state government who have provided staffing and pitched in other ways. We have done a tremendous amount of work on surge capacity to expand our testing capacity to go from no tests in the beginning of March to a record today of over 16,000 tests as it relates to our capacity, to really do the work we need to do with our local public health partners, to surge and wrap around their contact tracing capacity, to build up those assets so we are prepared moving forward in partnership with them to make sure that we're doing that work so that we can stop the spread and box in this virus as quickly as possible. And all that work has been really critical to our ability to, again, protect the health and safety of the people of this state. We will continue to do this work at DHS and across the government so that we are as prepared as possible for anything that may come our way later this summer or in the fall, so that we can continue to do the work of effectively responding to this pandemic.
Thank you, Emily. Now to Adam Rogan from the Journal-Times in Racine. Adam?
My question was answered. Thank you very much.
Thank you. Jonathan Nizer from NBC.
Can you hear me? Hello?
Is this Marty?
Hello?
Yes, we can hear you.
Okay, I'm so sorry. I always press the wrong button. I had a question about the New York Times article that identified Oshkosh in the Neenah area as one of the top locations for possible next large COVID-19 outbreak. And I wanted to see who could talk on behalf of that.
I've not seen the article, but Dr. Westergaard looked like he might have been.
Yeah, well, no, we're aware of a cluster of cases I alluded to earlier. There's, when we report the new cases every day, every one of those cases on an individual basis, we know where they live, and when we see multiple cases in a same jurisdiction, we work with the local health departments to identify who they are and do confidential contact tracing and see what locations they've been. And really the work that we do in public health is to understand how to contain those local outbreaks. So in the past several weeks, there's been an uptick. There's been a cluster of cases in Winnebago County, and we, on a daily basis, several times a day, are working with locals in that regard, in that jurisdiction, to understand who might have been exposed and give people the best advice about quarantine and isolation.
Thank you, Marty. Now to Jonathan Nizer from NBC 26. Jonathan? NBC 26. And a reminder, *6 to unmute your phones. We'll move on then to Riley Vetterkind from the Wisconsin State Journal. Riley?
Hi. Speaker Voss, during the May phone conversation, attributed the rise in COVID-19 rates in his region to a, quote, difference in culture in the immigrant community where people are living and working closer to each other. I'm wondering if Dr. Westergaard or Secretary Palm could address this comment, as well as what role, if any, immigration status, race, or ethnicity plays into the COVID-19 rates.
Well, certainly immigration status, race, or ethnicity have no biologic role in someone's risk of acquiring an infection given that you're exposed. But it's well described that someone's likelihood of being exposed is a reflection of how close proximity you are to other people who may be exposed. So working in indoor environments without physical distancing and without face masks is a well-known risk factor, and those things are known to be true independent of race, ethnicity, or background.
Thank you, Riley. Now to Eric Gunn from the Wisconsin Examiner. Eric?
I think my question is probably best directed to Dr. Westergaard. What kind of other patterns have you been seeing in terms of demographics or context of exposure in the data that has been coming across as far as infections? For instance, perhaps fast food workers as a group, or hourly workers in general, or workplace exposure versus other kinds of exposure. Have there been particular patterns in this regard along any of those or other lines that have surfaced with regard to how people are getting infected? Thank you.
Yeah, we have a great range of data that breaks down a lot of the categories, a lot of the parameters that you mentioned in your question on our website, and you can search for the patterns by the number of cases and the number of deaths and the number of cases that have been affiliated or associated with outbreaks in employment or long-term care. So there's too many things to sort of summarize or cover briefly here, but I'd point you to that resource, and I'd also say in general the data are skewed regarding severe clinical illness and deaths toward older people. That's well known by now, and a disproportionate number of people who live in residential care facilities and nursing homes have been infected. There's also disproportionate burden among people who work in healthcare and people who work in employment areas where physical distancing is difficult. So there's a lot to digest there. I'll point you to that resource, but nothing really striking that's different in the past 2 weeks compared to the past 2 months. The risk factors for transmission seem to be pretty clear, that it's close proximity in where people are exposed to respiratory droplets through speaking or loud speaking, shouting, without the precautions that we've talked about.
Thank you, Eric. Now to Jessica Van Egren from Up North News. Jessica.
Yes, my question has to do with a comment that Speaker Voss made during the taped conversation, where he again referred to the spike in COVID cases as just the difference of culture, where people are living much closer, working much closer together. Forward Latino and several other groups about a half an hour ago called for an apology from Speaker Voss. I'm wondering if Governor Evers thinks that's something that is in order in this instance.
Well, I'm not going to get into a situation to describe whether Speaker Voss should apologize or not. I didn't listen to the tape, and so I would have a difficult time commenting on whether he should apologize or not.
Thank you, Jessica. Now to Danny Maxwell from WKOW-TV in Madison. Danny?
This question, is for the governor. Governor, we've had a number of things going on in Wisconsin as far as racial disparities, racial injustice. You yourself have commented on racism being a public health crisis, and also the Legislative Black Caucus is asking for a special session on police reform. What do you want to happen, if anything, on police reform or legislation moving toward racial justice or helping our communities of color?
Yeah, thank you very much. We're at a watershed time in the state of Wisconsin relative to this issue. You look at the number of people that were peacefully protesting all across the state, from southeast Wisconsin and our urban areas to rural Wisconsin, where this isn't a direct impact on them. They just know it's wrong. And so, yes, we have to respond. And I have spent the last 2 weeks or so since Mr. Floyd was murdered in Minneapolis, and this whole process of our country coming to grips with this issue, and we're talking to mainly people on the ground, community leaders across the state, and they're demanding action. Obviously, we could do another task force or do another committee, but the people I talk to they believe, and I agree with them, that this issue has been with us for centuries, and it's time for action. So I'm looking forward to finding some common ground with the legislature to enact various pieces of legislation. I've mentioned that I support AB 1012, which is deals with the issue of use of force and how that we can provide a standard for people so that not only the police but the people that interact with the police are under the same understanding. In addition, we have to do things around making sure our communities are safer and stronger. This goes beyond policing. Believe me, it deals with issues such as housing, such as education, such as health care. All these things are connected to it. So I met with some legislators today, hope to do that sometimes next week. And we may, a special session is possible, but I want to make sure that it is something that we just don't gavel in and gavel out, because that would send the absolute wrong message to the people of Wisconsin who care about this issue, which is a vast, vast majority of them.
Thank you, Danny. Now to Bruce Marcus from WRJO Radio. Bruce? And a reminder, *6 to unmute your phones. Bruce Marcus from WRJO Radio. Okay, we'll move on then to Amy Reed from WISC TV in Madison. Amy?
Governor Evers,
yes.
How much responsibility do you feel for people waiting weeks and weeks to get any of their unemployment benefits?
Of course, I feel responsible. We would like to have every person that applies appropriately to have their checks delivered on time. Of course, you can't anticipate a pandemic. You can't anticipate going from a very low level of unemployment to exceedingly high level of employment. So we've done what we can. Do I feel that we it would have been great if we had that, that forward thinking that we knew a pandemic was coming and then lots of people would be thrown out of work. But it's difficult and very time-consuming work. It's not just taking the information. Many people have to have their cases adjudicated because they don't have all the information at hand, or some of their information is lacking from a former employer, so they have to go back to the former employer and get information. So it's not as simple as just talking to somebody and getting the money. It is a complex system. We've added hundreds and hundreds and hundreds of new employees. We'll continue to do that until we're caught up.
Thank you, Amy. Now to Victor Huckabo from CBS 58 in Milwaukee. Victor?
Thank you again for taking the call. Whether it's the public health crisis going on or the effects of the pandemic on the economy and other things going forward, for the state response, it's going to require, both the chambers of the executive branch and the legislative branch to move forward on that. And both Assembly Speaker Robin Voss and Senate Majority Leader Scott Fitzgerald said that the trust between legislature and the executive branch has been severely eroded because of the recording of that conversation. I'm wondering, Governor, if you anticipate, holding, how do you plan to heal that relationship, build back that trust? Do you see yourself holding a beer and brat summits? Do you see yourself holding more in-person meetings? How do you see that being repaired?
Well, all I can do is reflect back on the lame duck session. I was really irritated about it. I didn't think it was right. But that did not stop me from trying to work with the Republican leadership and Republicans in general to accomplish some things in that next budget, or that budget that was subsequent to that. So there's no reason in the world, there's no reason in the world that something as serious, it's even more serious than a budget. Systemic racism is serious. There's no reason why a serious topic like that should prevent us from moving forward. So, as I said before, I attempted to, after the lame duck session, to work with a legislature, and I did. we got a good budget passed. We didn't get everything. They didn't get everything. And so we can move forward. I mean, this situation is not something that is going to prevent us from doing the work of the people of Wisconsin.
Thank you, Victor. Now to Patrick Marley from the Milwaukee Journal-Sentinel. Patrick?
Hi, thanks for the call. I guess my question is for Ryan Nilsestuen. Attorneys are telling us that to comply with the one-party consent rule, it has to be someone not just on the line, but someone who identifies himself and is speaking on the call so the others know that person is there. So I guess my question is, were you aware at the time, Ryan, that the call was being recorded? And if you weren't, was Maggie Gow aware? Or I guess either way, was Maggie Gow aware?
Sure. As I said before, Patrick, that staff from both the legislative offices and the governor's offices were on the call, and staff consented to it being recorded.
Thank you, Patrick. Now to Mayan Silver from Milwaukee Public Radio. Mayan?
I'll let Patrick finish his question if you wanted to.
He already asked a question. It's your turn now. Mayan, go ahead.
Okay. I was just wondering if the Wisconsin numbers are going down as a whole, is there special consideration for urban areas like Milwaukee and Madison where a lot of protests are happening? Have you seen any spikes, and what are you doing to educate and prevent?
So I think for educating and preventing, we're doing what we've been doing for months, which is trying to communicate the basic infection control messages that everyone should know about, which is wearing masks and hand hygiene and physical distancing. And we're taking every opportunity we can to educate people about those things. The data that we're seeing that gets updated daily isn't showing a large spike, but as I mentioned before, every time that we see large, individual new cases or clusters of cases in an area, in any area of the state, we respond and treat it as an outbreak and try to understand who might have been exposed through the contact tracing methods that we've also talked about in these meetings. So I think the overall message is that it's encouraging. We haven't seen large spikes or large new epidemics, but we need to be really vigilant about containing the small ones as they pop up.
Thank you, Mayan. Now to WISN TV in Milwaukee. WISN.
Yes, Governor, some school districts are already sending out surveys about how comfortable parents feel about sending their kids to school in the fall. Have there been any decisions on sending kids back to school in the fall yet?
Yeah, the Department of Public Instruction, led by State Superintendent Carolyn Stanford Taylor, have been working with school districts, parent groups, teacher groups, and community groups all across the state, preparing a document that they'll be releasing sometime in the next couple of weeks about this topic and what school districts should expect and how they can reconfigure their classrooms accordingly. And they're doing that work not only in conjunction with the people at the local level, but they're also working with the Department of Health Services here in Madison. So that information will be that information will be released in the very near future within the next couple of weeks. And I think people will be pleased. It isn't going to be a prescription, but we do know that just talking to folks over at the department plus elsewhere in my travels, virtually travels, that parents are concerned, and we have to make sure that they feel comfortable and that the kids can get back to some sense of normalcy.
Thank you. And our final question today belongs to the Wisconsin Radio Network. WRN? And a reminder, *6 to unmute your phone. Either Bob or Raymond. Okay, well, that concludes today's media briefing. Please continue to monitor the DHS COVID-19 web pages for information, data, and guidance. More information can be found on the websites of the Governor, Wisconsin Emergency Management, the Department of Workforce Development, Wisconsin Economic Development Corporation, and the Department of Children and Families. Thank you and have a good afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civics broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.